I've been getting a lot of requests to respond to more Polidice videos, and truth be told, I wasn't really planning on responding to any more Polidice videos, just because Polidice is kind of a lame duck at this point. He hasn't uploaded a video in like over 2 years, and pretty much all of his videos have been debunked by other YouTubers. I just figured there was bigger fish to fry. However, in preparation for an upcoming healthcare debate I agreed to with someone in my Discord server, I figured responding to this video here would be a good way to hone my arguments, since this video repeats a lot of very common left-wing talking points in any healthcare debate. In this video, Polidice attempts to debunk what he feels to be our common healthcare fallacies made by the right, or by people who advocate for more market-oriented healthcare.
I've made several videos discussing healthcare to one degree or another, but in this video I want to talk about what I call the healthcare fallacies, where not only are the positions and the arguments wrong, but also the underlying reasoning and assumptions. So, cases where even if the picture could be right, the framing is definitely wrong. I've chosen 5 such examples commonly used by the right in the healthcare debate.
So notice how right off the bat, he's basically taking everyone who either criticizes socialized healthcare or supports free market healthcare and basically categorizes them all as the right. The problem here is that different societies and cultures have different political climates. So terms like conservative and liberal can mean different things to different people. It's true that most conservatives in the United States support a free market healthcare system, but it's not uncommon for conservatives in other countries to be in favor of socialized healthcare. By a similar token, many Democrats and left-leaning people in the United States support things like the Medicare Advantage marketplace, which involves a greater degree of privatization and freedom of personal choice than many other more socialized healthcare systems. The issue of whether to have a more free market or socialized healthcare system doesn't always fracture neatly along partisan lines.
Fallacy number 1, misuse of terminology. For me, this is by far the most irritating. When we talk about universal healthcare systems, I'm going to grossly oversimplify and say that there are essentially 4 tiers. Tier 1, nationalized healthcare. So in the UK, for example, where hospitals are publicly owned and physicians are public employees. An example of this in the US would be the VA for veterans. Tier 2, single payer, like the Canadian system, where hospitals are primarily private entities, but they and or the patients are covered by tax dollars. An example of this in the US would be Medicare for people over 65.
His description of a single-payer system isn't wrong per se, but it's not entirely accurate either. Here's a better way to describe what a single-payer healthcare system is. A single-payer system can generally be described as any system where one entity is responsible for acting as an intermediary to have healthcare provided to an entire group. It's a bit of a broad category and can encompass many different types of healthcare systems. Because of this, it's not entirely accurate to say it has to go through government or operate on tax dollars. Take lodge practice, for example. Lodge practice is a system where people would sign up to be a member of a lodge and then pay a membership fee into that lodge. The lodge would then negotiate with healthcare providers to have healthcare provided on behalf of its members. This is a good example of a privatized voluntary system that operates on the single-payer model. So if you like the single-payer model, there's actually ways of doing it without government.
Tier 3, multi-payer system, like in Germany, where there's a public option but also a private insurance system and everyone is required to pick one or the other. I do support single payer and Medicare for all, but personally multi-payer is my preferred option for the US.
I actually somewhat agree with Polidice on this point here. The multi-payer system is my preferred system because you get the best of both worlds. You're still free to choose your own health insurance plan in a private market, and there's a government-run healthcare system there is an option for poorer people who may not be able to afford a private insurance plan. So you get the benefits that come with UHC while still maintaining a free market for healthcare.
I think that we should model our healthcare system off of Germany's.
While I am a fan of the multi-payer system, I don't necessarily agree with the way that Germany does it. You'll sometimes hear people argue that Germany has a free market for healthcare because German citizens are free to choose between the government and private healthcare system. And while I certainly think this is preferable to forcing people to use the government healthcare system, this doesn't necessarily mean that Germany has a free market for healthcare. Germans are forced to pay for a certain minimum amount of healthcare coverage whether they want it or not. Private insurance companies are also heavily restricted on the amount of profit they can make or the amount of advertising they can do. So yeah, while the German system might give citizens a choice whether they want government or private healthcare, because the government forces them to buy health insurance and forces private insurance companies to basically operate on the same model that they do, it's really not that much of a choice.
An example of multi-payer in the US, kind of, is Medicaid for very low-income people.
Medicaid still mostly operates on the single-payer model. I think a better comparison to a multi-payer system in the US would be the Medicare Advantage marketplace.
Tier 4, compulsory insurance, like in Switzerland.
I want to briefly discuss the Swiss healthcare system since you brought it up, because Switzerland is a bit of an outlier. You see, Switzerland is one of the only countries in Europe with a mostly privatized healthcare system. Unlike in a lot of other European countries, most health insurance and healthcare in Switzerland is provided by private companies. And because of this, Switzerland has some of the best healthcare in Europe. Swiss hospitals have very low wait times, and Swiss citizens are generally satisfied with their healthcare system. Now, when you point this out to a lot of UHC advocates, they'll typically respond by saying, well, that's because the Swiss system is heavily regulated. Regulations are the reason the Swiss system performs so well, it's not because of the free market. Well, there are two problems with this argument. The first problem is that these regulations only cover insurance companies. They don't really cover the entire healthcare system. So they can't be an explanation for why hospitals perform well, because the regulations don't even cover hospitals. The second problem is that a lot of countries have these exact same regulations that Switzerland does, and their healthcare systems don't perform nearly as well. So it's dubious at best to say that the Swiss healthcare system owes its success to regulations.
Essentially, everyone is required to purchase insurance from private companies, and people who need help are given subsidies. This is essentially what Obamacare was trying to be, but it has been repeatedly undermined from the start.
You know, for as much as the left says that they hate private insurance companies, they go on and on about how awful and greedy they are. For whatever reason, they sure do seem to have a boner for forcing people to purchase their service. What exactly is supposed to be accomplished by forcing people to buy health insurance whether they want it or not? How would that make it more affordable? If you're forcing people to buy something whether they want it or not, wouldn't that create a bunch of artificial demand and raise the cost of health insurance?
So, since there are so many types of universal healthcare, it's very easy for its opponents to characterize it whenever possible. And it's not just the right. Supporters of single payer. So, since there are so many types of universal healthcare, it's very easy for its opponents to mischaracterize it whenever possible.
So yes, there are different types of universal healthcare, but since they all operate on more or less the same principle, point guns at people and force them to pay for something whether they want it or not, they all suffer from the same basic underlying issue. Because they all involve coercion, because they all involve taking away consumer choice, there's basically no market signals to indicate optimal resource allocation. This is why both Canada and the UK suffer from long wait times and rationing, even though they technically have different healthcare systems. It's not a mischaracterization to point out that all forms of universal healthcare operate on the same principle, therefore have the same underlying problem. Polidice is just trying to obfuscate the issue by being pedantic about his terminology.
But this is a favorite and definitely intentional tactic on the right. For example, Obama was constantly accused of running socialized medicine, as is Bernie Sanders.
That's because they both absolutely were advocating for socialized medicine. Both of their healthcare plans involved restricting individual freedom of choice in the healthcare market. Obama wanted to force people to buy health insurance whether or not they wanted it, and Bernie Sanders wants to straight up give the government a monopoly on health insurance. Anytime you point a gun to my head and say you have to spend your money on this or else, that is socialism. Period. The fact that the government might be middlemaning through private companies doesn't automatically make it capitalism.
And analogies for what their ideal systems look like have been chronically wrong.
Yeah, but it's not like the left doesn't inaccurately portray these systems either. A good portion of the public misconception about how these systems will actually work, believe it or not, actually comes from the very people who advocate for them. How many times have Obama and Bernie Sanders said, under their healthcare systems, you would have the same freedom of consumer choice that you would have under our current healthcare system? Even though if you read both of their proposed healthcare bills, they both restrict what type of health insurance people are allowed to buy. Now, if these healthcare proposals are both so wonderfully swell, then why would the people proposing them need to obfuscate so much about them?
Would a government-run, Canadian-style healthcare system work in the United States, a nation of 320 million people? Well, we already know the answer. Just ask America's veterans. They've had government-run healthcare for decades. The U.S. Department of Veterans Affairs, known as the VA, runs the largest hospital and healthcare system in America.
Well, America does have a single-payer healthcare system, and it's called Medicare.
So I do agree that the comparison being brought up in the PragerU video isn't entirely accurate. Comparing the VA healthcare system with a Canadian-style single-payer system isn't exactly fair, because they are different systems that function differently. The VA is a fully government-run system, where the hospitals are owned and operated by the government and the physicians working there are government employees. Whereas in a Canadian-style single-payer system, the government manages the healthcare financing, and the actual healthcare is largely provided by the private sector. A better comparison with the VA healthcare system would be the NHS over in Britain. It's a fully government-run system where hospitals are considered the property of the government. That being said, this is really the only defense I can muster for Polidice's arguments here.
But I guess it's just too wildly popular for PragerU to touch.
You do realize that PragerU has made other videos criticizing not just Medicare, but government-run healthcare in general. I'm assuming Polidice would know this since he has responded to other PragerU healthcare videos before. This is his only criticism of that PragerU video, by the way. He never actually addresses any of the arguments made in the video. In this video, you said you were going to criticize a single-payer healthcare system, and, actually, the VA does not count as a single-payer healthcare system. This just goes to show how he's being pedantic about terminology in order to avoid actually addressing the arguments at hand.
You know, when we talk about Medicare for all, the system that we're calling for is Medicare.
He acts like this is some kind of big gotcha, like this is a point that we all weren't supposed to know before. Like, yes, we're well aware that Medicare entails taking a Medicare and expanding it to cover all American citizens. That's exactly why we criticize it. There are a lot of problems with Medicare as it currently exists, which is why it can be called into doubt whether or not expanding Medicare to all American citizens is really a good idea.
It doesn't mean that the government runs the healthcare system.
No, but it does mean the government runs the health insurance system. Here's an aspect of Medicare for All that doesn't get much discussion in the public discourse. One of the things that the Bernie Sanders Medicare for All bill does, and it's very clear about this too, is that it bans duplicative insurance. What that basically means is that if the government plan covers something, then no private insurance plan is also allowed to cover that. This gives the government a monopoly on health insurance, full stop. So if you don't like the government plan, or if you don't like the way that the government is running their health insurance system, well then too bad, you're shit out of luck, because you got no options.
So when someone on the right says the left wants to nationalize or socialize our healthcare system, they're either being disingenuous or don't know what they're talking about.
The only one here who doesn't know what they're talking about is you. Because you, along with a lot of other leftists, seem to think that if something involves the private sector in some way, then it's automatically capitalism, even if it's based on coercion and limits freedom of choice. If you want to send someone with a gun to my house to kidnap me into a cage, because I choose to or not to spend my money a particular way, that is socialism, full stop.
I have heard so many arguments and seen so many comments, usually anecdotal, about the UK's healthcare system.
Anecdotal my ass. Not only is there a copious amount of articles and data that shows that the UK has abysmal healthcare quality, but British citizens also show a massive amount of dissatisfaction for their healthcare system. Whenever I make videos about healthcare, I always get comments from Canadians and Brits who are baffled, completely dumbfounded that there are Americans who envy their healthcare systems.
And it's almost always the UK they cite.
The reason we tend to criticize the UK in particular is because their system is particularly egregious, but all countries with universal healthcare experience these problems to one degree or another. In Canada, you have to win a lottery in order to see a doctor, and in Sweden, you have to basically beg for an ambulance if you call 911 since they're so short on them.
And first of all, the main issue with their system is that the Conservative Party has been starving it of funds.
So whenever you point out issues with the NHS, universal healthcare advocates will usually respond by blaming it all on conservative budget cuts. If it wasn't for conservatives starving these programs of funds, we wouldn't have all these problems, they argue. Well, there are two problems with this. The first one is that these problems seem to be in place whoever's in charge of the British Parliament. If conservative budget cuts really were to blame for the poor performance of the NHS, then we would expect to see the NHS perform better when conservatives are not in charge. But when you look at long-term data, it seems like the NHS performs pretty much exactly the same whoever's in charge of the parliament majority. And the second problem is that even with these so-called budget cuts supposedly in place, the NHS still seems to have plenty of money for elective procedures such as breast augmentation, so the problems with the NHS clearly can't be entirely chalked up to lack of funding. Here's the other thing to consider. If you have a voluntary medical system, such as a charity that provides healthcare or lodge practice or something along those lines, if it's being voluntarily funded, then there isn't a single thing that conservatives can do to take that funding away. So even if Polidice was correct here, this would still be an argument in favor of more marketized healthcare.
And second of all, we're not calling for nationalized healthcare. We're calling for a single-payer Medicare for all system.
Yes, you absolutely are calling for nationalized healthcare. I just explained a moment ago how the system that you advocate for centralizes government control and eliminates consumer choice. Again, the fact that you're middlemaning through private companies doesn't make it not socialism.
When Rand Paul had to go to Canada for an operation, pretty much everyone on the right argued that, oh, no, this is different, that doesn't count because the specific hospital that he went to was private.
I remember back when this happened, the left were like jizzing themselves over this. Like, a libertarian went to Canada for their healthcare. That means even libertarians think socialized healthcare is better. Well, don't get too excited, UHC advocates, because there are some important details here. First of all, Ron Paul didn't go to Canada for healthcare. Ron Paul went to Canada for a completely different reason than just so happened to need healthcare while he was there. Second, Ron Paul chose the specific hospital that he did because they were able to provide him the specific procedure that he needed done, not because of the superior quality of the Canadian healthcare system. Third of all, and most importantly, since Ron Paul is not a Canadian citizen, he's not covered by the national health insurance system, and therefore had to pay for his healthcare out of his own pocket.
Privately owned, yes. Just like most hospitals in Canada, it's mostly publicly funded and free for Canadian citizens.
So yes, while the Canadian system isn't fully nationalized the way that the British system is, and therefore avoids a lot of the pitfalls that the British system suffers from, the Canadian system has a problem of its own. You see, there's a phenomenon in economics called third-party purchasing. This basically describes any sort of situation in which an economic decision is not motivated by either cost or quality, since the person responsible for making that decision is not the one paying for it or using it. In this case, the Canadian government is spending other people's money, so it doesn't care about cost, on services that it's not using, therefore doesn't care about quality. So while Canadian hospitals might be technically on paper privatized, these hospitals aren't being incentivized to cut costs or increase quality because they're being funded by a massive bloated bureaucracy as opposed to directly by the consumers. I mean, the biggest advantage to privatization is the incentive to economize. If you're still not going to have the incentive to economize there, then why even bother privatizing at all?
So whether Rand Paul likes it or not, he was treated by doctors who work in a single-payer system.
Except Ron Paul is not a Canadian citizen. Therefore, he's not covered by Canada's national insurance plan, therefore he ultimately paid for it out of his own pocket. Not only that, but he ended up paying more than a Canadian citizen would have had to, if the Canadian citizen would have had to pay for it out of pocket. Here's something that UHC advocates never want to discuss. If you're a non-citizen seeking healthcare in a UHC country, not only do you have to pay for your healthcare out of pocket, but you actually end up paying more than a citizen of that country would have to if they were paying out of pocket. Here's what I mean by that. Let's say that you go to Britain and you break your leg. If you're not a citizen, you're not covered by the national insurance policy, therefore it comes out of your own pocket. Your broken arm is going to cost you 1.5 times what it would cost an ordinary British citizen if they were paying out of pocket. So what that basically means is that you have to not only pay for your own broken arm, but also shoulder half the cost of someone else's broken arm. The only reason a healthcare system would need to do this is if they were running at a loss. This is why it can be deceptive when the left argues that universal healthcare would save money. Because a lot of the costs associated with UHC end up getting absorbed elsewhere, these costs are essentially hidden from view.
So we'll have to ask him how his slaves were treated.
So real quick, I want to address this argument that compares a positive right to healthcare to slavery, because it's one that tends to get misunderstood and misrepresented a lot, especially by people on the left. You'll often hear the argument that, no, socialized healthcare isn't actually slavery, because doctors and other medical staff are free to come and go as they please. And while maybe the doctors and medical staff themselves aren't the ones being enslaved, because a positive right to healthcare would still impose an obligation onto others that they never agreed to, it's still a form of slavery. Even if the doctors themselves aren't the ones being enslaved, you're still claiming a right to the resources and effort of others against their consent. Therefore, it's still slavery. If you have a right to health care, that means that the rest of us are forced to pay through it through taxation, whether we consent to it or not. We have an obligation placed onto us without our consent, therefore it's slavery. You see, taxation isn't just theft, it's also slavery. If the government taxes your income at 25%, that means they're claiming a right to 25% of the labor that you perform. So for every 3 hours you work for yourself, 1 hour you work for the government against your will. This is partial slavery. You're not fully bound to work for the government, but it is still slavery nonetheless.
Fallacy number 2, decisions. The argument here is that having universal health care is bad for us because it disincentivizes us from staying healthy and making good decisions because there's no longer a financial penalty.
If these are the poorest Americans who are getting their co-pays and things like that covered, what's the motivation for them to try to live a healthier lifestyle? I mean, if it doesn't cost them anything to go to the doctor, what's the motivation?
But it is not my job to pay for your health care, because if I'm paying for your health care, that creates a perverse incentive system where you can go make a bunch of decisions that are not great for your health, knowing somebody else is going to pick up the tab and access health services at a faster pace.
First of all, this is utter nonsense. Pretty much every country with higher life expectancy than the US has universal health care. And if these conservatives are asked why they have higher life expectancies, they will tell you that it has nothing to do with their healthcare systems, but rather it's because their citizens have a healthier lifestyle than Americans do. Okay, I rest my case.
So I agree that life expectancy isn't actually the best metric to use here, since life expectancy is a bit complicated and a lot of different factors go into it. A better metric to look at here would be hospitalization rates for medical conditions involving lifestyle choices. And what's interesting is that hospitalizations due to drug overdoses tend to be higher in blue states and blue cities, because in these places you're more likely to have the taxpayers pick up the tab if you overdose on heroin. Therefore, people are more likely to overdose on heroin. Now, to be fair, this is just a correlation, not necessarily a causation. There could be other factors at play here. But I think it goes without saying that you're less likely to make good health decisions if other people are picking up the tab for your health care.
But as for the underlying reasoning, these sociopaths...
By the way, this is a typical thing that Polidice does in his videos, using emotionally charged language in order to attack the character of his opposition. You know, someone probably doesn't have a very good argument to put forward if they have to resort to tactics such as this.
Want you to be so petrified by fear of going bankrupt or dying because you can't afford healthcare that it completely shapes the way that you live.
It's usually the people who are in favor of UHC who want to control other people's lifestyle choices. One thing that the left has a massive boner for are laws that force people to wear seatbelts and motorcycle helmets. They argue that the burden that you put on the public healthcare system by not wearing a seatbelt or motorcycle helmet legitimizes taking away your freedom of personal choice on this issue. Here's an issue that's not frequently brought up in universal healthcare discussions. When you collectivize healthcare costs, you also collectivize healthcare responsibilities. When everyone else is forced to pay for your healthcare, the cost is no longer just your responsibility, it's everybody's. Which means that society now has a vested interest in your personal lifestyle choices. This is why in a lot of UHC countries you tend to see a lot more state paternalism. Laws that restrict how much sugar and fat are allowed to be in foods, or laws that restrict smoking or skateboarding or other activities that may cause illness or injury. And it's hard to fault these countries for having these laws when everyone is forced to pay for everybody's healthcare. Somebody else paying for my healthcare but also getting to dictate my personal choices seems like a Faustian bargain. I'd much rather just pay for my own healthcare and be free to make my own lifestyle choices.
And this weirdly draconian mentality is just nonsense. You know why people don't want to be in car accidents or get cancer? Because nobody wants to be in a car accident or get cancer. The disincentive for needing medical attention is self-explanatory, like, holy shit, guys.
So nobody's arguing that having people pay for their own healthcare will completely eliminate the need for people to get healthcare. Yeah, of course people are still going to need healthcare even if they're forced to pay for it out of their own pocket. What we're saying is that if people have to pay for their own healthcare, then they're more likely to make healthier decisions and therefore are less likely to need healthcare. Nobody wants to be in a car accident or get cancer. The motivation to avoid these things is pretty self-explanatory. Polidice is correct about that. However, if people were forced to pay for their own car accident or their own cancer, they might be more likely to think twice before they decide to drive dangerously or smoke. Having people pay for their own health care isn't going to completely prevent people from getting sick or injured, and nobody's arguing that. But it is more likely to coax them into making better decisions than a system where everyone else is forced to pick up the tab for their health care.
A financial penalty for going to the hospital doesn't disincentivize you from needing to go to the hospital.
Notice how he describes paying for your own healthcare as a financial penalty. Like, no, it's not a financial penalty, it's just you providing payment in return for services that were rendered. Paying for your own doctor when you get sick is no more a financial penalty than paying for your own mechanic when your car breaks down. When my car breaks down and I take it into the shop, I'm the one who pays for it. Am I being financially penalized because the auto shop isn't sending men with guns around my neighborhood to force everyone else to pay for my car? The rhetoric here is just absolutely ridiculous. You know what is a financial penalty, Polidice? You wanting to send men with guns to my house to force me to pay for everybody's health care. When the government points a gun to your head and says hand over 20% of your income or else, that's a financial penalty.
It disincentivizes people from actually going to the hospital when they need to.
Healthcare costs disincentivizing people from seeing a doctor isn't necessarily a bad thing. And here's why. If seeing a doctor is free, or at least significantly subsidized, then you're much more likely to go see the doctor anytime you have a minor ailment such as a cold or a stubbed toe that doesn't really require any sort of significant medical attention. And this would obviously distract the doctors away from treating other patients with more serious ailments. Costs are always going to deter consumption of a particular good or service to some extent. That's just a natural part of the market determining optimal resource allocation. Now that being said, of course it can be excessive. When healthcare costs are too high, that does in fact deter people from seeking out medical attention when they desperately need it, and that is a genuine problem. But at the end of the day, we live in a world where there's more demand for resources than there are resources to satisfy those demands. And to some extent, costs are going to have to deter people from accessing too much of a resource when other people need it.
I know this is anecdotal, but I cannot tell you how many times I've heard people say that they don't want to go to the doctors because even with insurance it'll cost hundreds of dollars.
So what's your alternative then? Stick them on a waiting list so they end up not getting access to their healthcare anyways? I said it once and I'll say it again. I am not a fan of the US healthcare system. I think it's way too expensive and I'm all in favor of making healthcare more affordable and accessible. But given the track record of the British and Canadian healthcare systems, it hardly seems like more government involvement is the answer. And yeah, I also agree that insurance co-pays and premiums are way too expensive. Increasing competition between insurance companies would be a very good way to get those costs down. But Polidice has said in previous videos he's against allowing people to purchase insurance from out of state, so yeah.
And this leads to a lot of problems for a lot of people. Really, if this argument were valid, then you'd expect poor people to live significantly longer than rich people, when of course the opposite is true.
So which is it, Polidice? Are life expectancy statistics a good way to gauge the quality of a healthcare system, or are they not? You can't have your cake and eat it too.
Speaking of which, you may have noticed that this argument is never applied consistently. So let's take Jeff Bezos for example. Bezos has so much money that what incentive does he have to not get a stroke or an infection? I say that if we really care about the health of Jeff Bezos, then any hospital that he visits should charge him $10 billion just to make sure that he's incentivized to make good decisions, right?
Hey pal, you just blowing from Stupid Town?
This isn't a fair comparison. Arguing that people should be responsible for their own healthcare costs and the personal lifestyle choices that may contribute to those healthcare costs is not the same thing as arguing that wealthy people should be charged artificially more for their healthcare to deter them from making bad lifestyle choices. If Jeff Bezos decides to eat a shit diet, never exercise, never take care of his hygiene, abuse drugs, etc., then I think he's responsible for whatever healthcare costs he incurs as a result of these activities. And I would never advocate that anyone else be forced to pay for his lifestyle choices. That being said, if Jeff Bezos decided to live a healthy life and avoid all of these exorbitant healthcare costs, then good on him. I think he deserves those savings, and I would never advocate that he be stolen from to pay for other people who make bad lifestyle choices. At the end of the day, the argument comes down to, is it fair to force people who make good choices to subsidize the consequences of those who make bad choices?
Before I get to the third fallacy, thank you patrons, and a very special thank you to Abdullatef Alzamel, Anime Titty Fan, Craig Ellen Feist, Denzel Jackson, Eguinaldo Estrada, Joseph Connor, Leonard Mathieson, Matthew Lentz, Mika Argyropoulos, Sebastian Kroll, Susie M., The Gonzo Tribune, William Heineman, and Yavin Arba.
You know, for someone who likes to shit on private voluntary charity and say that it can never work, Polidice sure loves to shill his Patreon page. Oh, by the way, I also have a Patreon page. If you like the content that I produce and want to help improve the quality of my videos, there's a link to my Patreon down in the description.
Fallacy number 3. Cost, specifically in regards to the arguments that only look at how much a single-payer system would cost the government, without mentioning what our private system costs all of us.
The reason we don't mention what the private system costs is because that's a red herring. US health insurance is a shitty, overpriced system, just like the shitty, overpriced system that you propose. Pointing out the flaws in the US healthcare system, which there are plenty of, I'm not going to deny that, doesn't make the flaws with your system magically disappear. The reason UHC advocates often bring up the US system or problems with the US system is because it's a red herring. They can use it to distract criticism away from the systems that they advocate advocate for. Like, yes, the US healthcare system sucks, we know it does, but so does the one that you propose.
People say that we can't possibly afford Medicare for all because it'll cost $32 trillion over 10 years, and how are we going to pay for that?
This 32 trillion figure comes from a Vox article, so I would take this with a grain of salt. Other estimates have put the cost for Medicare for all at 40 or even $50 trillion over 10 years. Projections for Medicare have tended to lowball the actual cost significantly, so it's very much within the realm of possibility that Medicare for all will end up costing way more than it's projected once implemented, just like regular Medicare. But let's, for the sake of argument, just take it for granted that the 32 trillion over 10-year period figure is accurate. That would still equate to $3 to $4 trillion a year, even according to these projections, which I have a feeling are being lowballed. If Medicare for all were to pass, it would easily be the single most expensive federal program in history. You would have to basically devote the entire federal budget to just Medicare, and even then you'd still run a deficit of over $700 billion a year. Over $700 billion a year would have to go on the national credit card just to keep this monstrosity afloat.
But pretty much every estimate puts our private system at a higher number, either by hundreds of billions or even trillions.
Pretty much all of the figures he uses for private health insurance costs in the United States come from very left-leaning sources. So once again, I'm taking this with a huge grain of salt. But yeah, it's no secret that health insurance is way too expensive in the United States, and I'm in favor of bringing those costs down just as much as anyone else. But I also understand that to a large extent what's responsible for those high costs is government intervention. Insurance companies have to comply with a lot of regulations, which raises the cost of doing business, and people are often forced to purchase more coverage than they need. One very simple fix that could easily reduce the cost of health insurance is to allow competition between states. But once again, this is something that Polidice is against.
I would much rather have healthcare funded by a progressive tax structure than charging people based on the usage of healthcare.
So notice how Polidice is framing this issue as a false dichotomy, as if these are the only two options. Either we fund healthcare using this specific tax structure that I like, or people are just on their own. We libertarians have actually had extensive conversations about how we can make healthcare more affordable and accessible without needing taxation. Charity, lodge practice, health savings accounts, allowing insurance companies to compete across state lines, getting rid of statement of need requirements for new hospitals. These are things that not only would make healthcare more available, but wouldn't cost that much to implement either. But Polidice isn't interested in having a conversation about these because these don't empower him to decide how to spend other people's money, so it doesn't fit in with his agenda.
Every OECD country has some combination of public and private healthcare spending.
Yes, and as a result, none of them perform as well as they could if they had a fully privatized free market system.
And when you look at how America is spending 2 to 3 times as much for worse outcomes, you have to ask, how are we going to pay for that?
Worse outcomes according to what metric? I mean, yeah, sure, the US healthcare system has its problems, but it's not like we're intentionally killing people to free up bed space like they do over in the NHS, or forcing people to wait months or even years for vital operations like they do in Canada.
The most expensive healthcare system in the world. Or more specifically, how are the people who can't afford it going to pay for it?
Again, we know what the answer is because we've had solutions to problems like this before Medicaid and Medicare. There was something called lodge practice. People would sign up to be a member of a lodge, pool all their money together, and then the lodge would negotiate to have health care provided on behalf of its members. Lodge practice was able to get the cost of health care so low that the average working class person could afford a year's worth of health care on one day of salary. Polidice is acting like big, expensive government programs are the only way to make healthcare more affordable and accessible to middle and lower class people, and we know from historical precedent that that's not true.
They can't, which is why so many people in this country die or go bankrupt, because we're treating something that is clearly a right as if it were a privilege, only for those who can afford it.
There's no such thing as a positive right. You don't have the right to demand time, labor, and resources from other people against their will. Nobody else is your slave. And declaring something a quote-unquote right doesn't magically make more of it available. The Soviet Union declared food and housing to be a right, and they still had massive amounts of starvation and homelessness. Now, if you want to argue for a right to health care in a negative sense, that is, the right to seek out health care on your own terms without anyone forcibly interfering, then alright, fine, I can get on board with that. But that would also negate a lot of the things that Polidice advocates for, such as giving the government a right to monopolize health insurance.
Fallacy number 4, choice and competition. The idea here is that under our private insurance system, you have choices, like how high are your premiums, and how high is your deductible, and Which hospitals are in your insurance network?
That's right. In a free market healthcare system, you get to make all of those decisions. You get to decide what type of coverage you want, how much you're willing to spend, how much you want your copays to be, instead of some bureaucrat making all those choices for you. Now, I would argue that under our current state of affairs, we're not totally free to make all of our decisions regarding our own health insurance. Purchasing insurance from an out-of-state company is prohibited, as is not carrying certain types of coverage that the state mandates.
Okay, guys, this isn't like pizza toppings or ice cream flavors. Choice in this context is a bad thing. I know the followers of the free market religion don't like the sound of that, but it's absolutely true.
This is such typical statist propaganda, fear-mongering about how your individual freedom of choice is a bad thing. You're all too stupid to make decisions for yourself, so let some bureaucrat make all your decisions for you.
A big part of why our healthcare costs are so high is that so much of the money goes to administrative costs.
This is a very common talking point used by people who argue against free market healthcare. They say that one of the reasons that free market health insurance is a bad thing is because private insurance companies have high administrative costs. They make this argument up and down a blue streak, but the problem is they never explain what they mean. Administrative cost is a vague term that can encompass any number of things. It's just a boogeyman term that they throw around in order to scare people without actually explaining what it means. And by that same token, they never explain how their system would reduce this so-called administrative overhead. This is especially a problem when you consider that unlike the public sector, the private sector has an incentive to keep costs at a minimum. Now, presumably what I'm assuming they mean by quote-unquote administrative costs is the massive amount of paperwork that insurance companies and doctors are forced to fill out. But a lot of this paperwork is mandated by government regulation. Recall that private companies have an incentive to keep their operating costs at a minimum, which means that no private company would be willing to take on these extra administrative expenses unless they were forced to. It's also not necessarily the case that UHC countries have lower administrative costs. I've linked to an article in the description that discusses this further.
In advertising.
So this is a claim I hear very frequently from the left, that one of the reasons that healthcare is so expensive in this country is because of all the money that insurance companies spend on advertising. The problem is whenever they make this claim, they never back it up with any data. If they were making the argument that advertising expenses are a major contributor to healthcare costs in this country, then you would expect them to present some sort of data that shows advertising expenses make up an egregiously large portion of an insurance company's operating budget. But whenever they make this claim, they present no such data. It's hard to believe that purchasing a billboard here and there would really drive up the costs of healthcare that much.
One of the best parts of a universal healthcare system is that it's so much simpler for everyone.
Right, but simpler doesn't necessarily mean better. Is your healthcare system being quote-unquote simpler really that much of a benefit if it means you're stuck in long waiting lists? And it's not like we couldn't make things simpler or more intuitive under a privatized system. One big reason for all the complication we see in our current healthcare system is because of government regulation mandating all that paperwork.
A lot of people are convinced that if we only treated healthcare like it was a free market commodity, then all of our problems would be solved.
That's because healthcare is a free market commodity. Nothing about healthcare exempts it from the laws of economics. It's a service that's based on limited resources that other people have to put in effort and labor to provide.
Which is kind of like saying that your goldfish would live longer if you treat it like a sea turtle.
So why is it then that we see healthcare services and resources becoming not only more available, but also less expensive whenever they're marketized? We see examples of this everywhere. When a medical service or resource is deregulated and opened up to fair market competition, not only does quality improve, but costs go down as well. We've seen this with defibrillators, we've seen this with laser eye surgery.
There are so many reasons why healthcare and pharmaceuticals are not like fruits or books. Just list a few. Inelastic demand.
This is a bit of an oversimplification. The elasticity of demand for any particular good or service is going to be determined by a multitude of different factors. Also, you have to consider that healthcare is a pretty broad category of different goods or services, all of which may have vastly different elasticity of demand. There are also other things which tend to have inelastic demand, such as food, shelter, and transportation, but I don't hear Polidice calling for the government to control all of that stuff.
Inherent lack of choice in treatment. Lack of ability to make a perfectly informed and rational decision, especially in emergency situations.
So one thing that statists will commonly do is they'll take specific emergency situations and act like these are somehow applicable to the day-to-day status quo. In specific emergency situations where someone needs health care right away, then in that situation maybe they're not able to make a rational informed decision. Fair enough. But it's not like every single time someone seeks out health care, they're in some sort of immediate emergency life or death scenario. A majority of health healthcare is shoppable. And even in those immediate emergency situations where someone might not be able to make a decision right away, that still doesn't mean we have to have government control everything. People can make contingency decisions ahead of time in case the emergency happens. That way they don't have to make the decision when the emergency's happening. People can already do this. People already file statements of medical intention with their insurance companies.
High barrier to entry for providers, etc.
Pretty much every barrier to entry in our healthcare system comes from the government. Whether it be requiring new hospitals to get a statement of need before being allowed to open, requiring doctors to go through a bunch of hoops in order to get a license to practice medicine, or the massively burdensome process the FDA forces new drugs to go through. As a matter of fact, I can't think of a single barrier to entry to healthcare providers that doesn't come from the government.
A common argument that I hear regarding this is that if we have a single-payer healthcare system, then that's a monopoly, and monopolies inherently mean lower quality and higher prices.
Recall from earlier in the video, all a single-payer system is just some sort of system where one entity negotiates to have healthcare provided on behalf of a group. It doesn't necessarily have to be monopolistic, but the way the government does it usually is.
But there are two problems with this. First of all, a monopoly means that there is a single provider, not a single buyer. A market with a single buyer or single payer is called monopsony, which arguably has the opposite effect.
So again, he wants to be pedantic with terminology to obfuscate the issue. Your proposed single-payer healthcare plan would restrict my right to choose who I want to purchase my health insurance from. Therefore, it is a monopoly.
Secondly, monopolies only lead to higher prices because there's a direct profit motive. Whereas governments, even the NHS, which is also basically a monopoly, they have every incentive to keep prices low because it's not for profit. It's not a for-profit system, but rather a public service.
I love how statists like to believe that their magical government is somehow exempt from the laws of economics. Well, yeah, monopolies usually lead to higher prices and lower quality, but in this case it's okay because it's my wonderful magic government doing it. Hey Polidice, I got news for you. Profit seeking also happens in government too. That's right, even in UHC countries, politicians enact policies that enrich themselves and their cronies. The idea that the people in government have some kind of superior benevolence above the average person is wishful thinking, to say the least. And it's not like the private sector can't provide non-profit services. There are tons of non-profit charities and even insurance companies in the private sector. So this idea that only the government can do things for the public good isn't even true.
Many ways people might argue that choice is important is that, oh, well, why do you want healthy people paying for sick people, and why do you want men paying for women's health care, and why do you want this paying for that? All of those are good things. It keeps prices low for people who need them lowest the most. It's good for young and healthy people to pay slightly more so that older and sicker people are not completely screwed over.
Hey, Polidice, weren't you earlier in the video complaining about how expensive health insurance is? Well, as it turns out, people being forced to buy more coverage than they need is one of the reasons why health insurance is so expensive. Forcing people to buy more of something than they need is going to make it more expensive for them. I figured that would pretty much be common sense.
That's how insurance works. That's how we pool our resources together for the collective benefit.
So, Polidice, are you in favor of forcing insurance companies to cover pre-existing conditions? Because insurance, like you mentioned a moment ago, operates on a pool of money. And in order for that pool of money to be consistently available, there has to be more people paying into than drawing from that pool of money at any given time. Forcing insurance companies to cover pre-existing conditions would basically eliminate any sort of incentive for people to pay into that pool of money. Because if people can just retroactively take out a health insurance policy after they need it, then of course they're going to wait until they need to draw from that pool of resources before they actually start paying into it.
Fallacy number 5, healthcare tourism. I'm sure you've heard the argument that the United States must have the best healthcare system in the world because people from all over the world come here for treatment. The fallacy here is that it looks at wealthy people coming here for specialized elective procedures, and then you're extrapolating that to the entire healthcare system.
Well, of course, wealthier people tend to travel more for healthcare because wealthier people are more likely to have the money and resources to travel to other countries. So you're going to see a disproportionately high number of wealthier people when you look at statistics for healthcare tourism. This is going to be true for UHC countries as well.
Universal healthcare systems ration care based on need, whereas we ration care based on price. So if you're an uber-rich person who wants cosmetic surgery, then yeah, our healthcare system is made for you. But if you're not rich and you need to be treated, then you and the overwhelming majority of people will be better off in any other developed country. They will treat you based on the urgency of your situation.
So this is a common left-wing talking point. Well, sure, maybe UHC countries have longer than average wait times, but your place in that waiting list will be determined based on the urgency of your condition. The problem is that there's basically no reason to believe this. The NHS has been very notorious for prioritizing elective procedures over emergency care. So when you get put on the massive waiting lists in a UHC country, there's no guarantee that you'll get bumped further on that list if your condition is urgent.
And in most of them, you will be charged nothing.
Oh, wait, you serious? Let me laugh even harder.
Oh, it's not free, you fucking pay. If you're a citizen, then you pay through your astronomically high taxes. If you're a non-citizen from out of the country, then you pay out of pocket, more so than what an actual citizen would have to pay if they had to pay out of pocket. Because in almost every instance, UHC systems run at a loss, so they have to recoup those costs in other ways. This is why it's so deceptive when socialists say that UHC saves money, because they focus on direct costs and don't pay attention to how those costs are absorbed in other ways.
Could you, an American, imagine that? Just going to a hospital in the US to get something checked out can cost hundreds of dollars even with insurance.
Again, I completely agree that American healthcare is way too expensive, and I'm all in favor of bringing those costs down. But Polidice, just like many other people on the left, wants to just blame all of that on the free market and not have an honest conversation about why American healthcare costs are so high. And that's probably because if they did, they'd realize that the blame really falls at the feet of their government.
Also, this idea that other developed countries have these terrible wait times is grossly exaggerated, and statistics for that are almost always about hip replacements or some other elective procedures.
He, of course, doesn't provide any data to show that wait times in UHC countries are exaggerated or cherry-picked. We can point to example after example of people suffering and often dying because of wait times in UHC countries. If you think that these are being exaggerated or somehow portrayed inaccurately, then fine, go ahead and make that argument, but let's see some data to back it up.
And they still get hip replacements, not like they don't get them.
Oh yeah, sure, they still get their hip replacements. They just have to endure 6 months of agonizing pain in the interim. You know that one lady in the UK who had to pull her own teeth out because the pain eventually became so unbearable? If she would have just endured the pain for a couple more months, she probably could have gotten a dentist to help her with that.
It should go without saying that the US also has issues with wait times and ER blockage too.
Yes, it is true that the US can sometimes experience a lot of these same problems. However, because the US is a comparatively more marketized system, it experiences these problems at way less of a severity. Also worth pointing out is that the hospital in question in this tweet here happens to be in a very blue city in a very blue state where there tends to be more government control of healthcare. Now that's a rather interesting coincidence, isn't it?
And most important point, it's not even true that the US is a hub of healthcare tourism.
Well, it's a good thing then that nobody was arguing that it is. It's true that the US doesn't have the highest level of healthcare tourism in the world. Countries like India and Myanmar actually have higher levels of healthcare tourism than the United States does. What we are arguing is that the United States tends to have higher levels of healthcare tourism than countries with UHC.
Look at this. About 1 million Americans leave the US for cheaper medical treatment a year.
1 million people is less than 1/3% of the population. That's hardly an alarming figure. Also, when people leave the US for healthcare, what countries are they going to? Typically India, Myanmar, Brazil, countries with less regulations and more of a free market for healthcare.
Now, the Canadian healthcare system does have issues and is often ranked as the second worst healthcare system in the developed world. You'll never guess which one's dead last.
So one argument you'll commonly hear from the left is that the US has a low-quality healthcare system. It ranks so poorly. The problem here is that whenever they do this, they typically choose to focus on rankings where the US does particularly poorly. When you look at healthcare quality considered as a whole, the US performs actually pretty well. I mean, let's get real for a second. It's not like the US has some kind of third world healthcare system where you're wheeled into some makeshift shack hospital with dirt floors and straw beds, where you're operated on with old rusty tools.
Probably the best story of the year so far, as I mentioned earlier, Rand Paul, of all people, had to go to Canada for a special surgery that a predominantly publicly funded Canadian hospital was uniquely suited to treat.
Yes, Ron Paul went to that hospital because they were uniquely suited to provide a treatment that he needed. It wasn't because the Canadian system is so superior in quality to the US system. Also, as a non-Canadian citizen, Ron Paul still ended up paying for it out of his own pocket, so he wasn't participating in socialized medicine. So yeah, Polidice, you can put your lotion away and put your dick back inside your pants.
The idea that the quality of care from the US stands supremely tall above the rest of the world is just nonsense.
Nobody's necessarily arguing that the US healthcare system stands supremely tall above every other country in the world. The US healthcare system has a lot of problems with it. I've criticized it on many occasions. There is a lot to criticize about the US healthcare system. However, as a comparatively more marketized system, for the problems that it does have, it does excel in certain areas, namely in cancer treatment and also pharmaceutical innovation.
Out of 11 countries studied by the Commonwealth Fund, which is an American think tank, by the way, the US ranks number 5 in quality of care, so average as far as the 11 developed countries go. And when the rest of the categories are included, the US healthcare system ranks dead last.
So the Commonwealth Fund is a left-wing think tank. Their stance is very clearly pro-UHC, which means they have skin in the game, making them far less likely to be an unbiased source. They've made articles defending the British NHS, in spite of the NHS having some of the lowest approval rates in Europe, and one of the articles they've published, saying that wait times aren't really that big of a deal in Canada, ended up getting fact-checked. So yeah, anything this organization puts out regarding healthcare should be taken with a grain of salt.
Now, let's talk about political healthcare tourism, as in which countries are trying to be like which countries. The overwhelming majority of Americans want a universal healthcare system.
It's very common for Medicare for All supporters to point to polling data such as this to try and show why their single-payer plan is very popular. The problem here is that because of a lot of public misconceptions about the way these systems actually work, people often respond to these surveys in ways that don't actually honestly represent their opinion. For example, a majority of Americans hold the mistaken belief that under a single-payer system, they would get to keep their doctor, their insurance plan, all their medical decisions as is, no questions asked. When pretty much none of the single-payer healthcare bills being put forward by left-wing politicians would allow them to maintain the right to make those decisions.
Whereas no other country in the world is trying to emulate ours. If a politician in Canada, the UK, France, or Germany said they wanted to reform their healthcare systems in the image of the US, gone. Done. Political career over. Because in terms of who envies whose healthcare system, no other country is staring at ours.
If this is true, then why do we see countries like Norway and Denmark, countries that have historically embraced the government-run single-payer model, start to privatize aspects of their healthcare system and expand consumer choice?
The phrase American exceptionalism fits nicely here. Not in the sense of America being an exceptionally great nation, but in the sense that we have this mentality where even if the rest of the world has figured something out, whether it be the metric system or paid leave or action on climate change or healthcare in this case, America is the one and only country that instead of saying, hey, maybe those guys are onto something, says, wow, look at those idiots over there.
Notice how these are all basically euphemisms for expand government power. Paid leave means point guns at business owners and make them run their business a particular way. Action on climate change usually means stomp on some businesses and support others. And in this case, we already know what Polidice's position on healthcare is, point guns at people, because of course it is, what else? Now of course we can have honest, good faith discussions about different ways to address these issues, but since Polidice's goal here is to push a narrative where he gets to expand the role of government to control our lives, he's not particularly interested in that conversation. Yeah, this one ended up being way longer than I initially anticipated, but in this video Polidice just kept repeating all of the most common left-wing talking points on healthcare, so I feel this necessitated a very thorough rebuttal. Anyways, like I said before, I plan on debating someone on Discord about healthcare. That debate should be uploaded sometime next Saturday, so if that's something you'd be interested in watching, then please subscribe and stick around for that. Until next time, this has been Philosophossum making stupidity play dead. Have a good one.